Hi guys, it's Dr. Somji.
And it's Dr. Solomon here.
Welcome back. We've done a few videos, actually popular videos on Profhilo, like an injectable skincare.
Yeah.
And we're going to tell you honestly what we feel about Profhilo.
What do we really think about it?
I was one of the first doctors to inject Profhilo.
Right,
So
I
I've been
think your
injecting
mother.
it. Yeah, my mum was one of the first to have it. She said to me it's like having a facial. So, the key question I get asked is, she said, well, let me clarify that. She said, it's like having a facial that lasts about a month, okay?
Yeah.
Now, obviously, she's my mum, so I don't charge her for anything, okay? She's done enough for me in her life, so she gets it for free. So when she had it for free, she comes for it, she's for free. But what if you had to pay for it?
Yeah.
And is it worth it when you pay for it? And I think that, you're gonna tell me, you've got someone like me that comes for Profhilo. Would you treat me with Profhilo?
So you're coming to me for a Profhilo. Would I say it's worth it? In your case particularly, I would probably advise against it. And why would I do that? Why would I advise against it? Because I don't think with your skin, I think you have actually good, well-hydrated skin. I think you have very few lines. I don't think you've lost much volume.
Yeah.
I don't think the Profhilo would offer you the benefit considering the cost of it. The cost benefit is not, in my opinion, worth your time and worth your spend. So I would not recommend it. Where I might recommend it in your case is if you were, let's say, injecting Profhilo, considering injecting Profhilo for the sake of building collagen for the future. However, I would combine with other therapies. I would combine it maybe with radiofrequency therapy, possibly even laser therapy, certain types of laser, possibly other injectables that we talked about in another video, injectable moisturizers that stimulate collagen. But on its own, in your case, I wouldn't. Where would I recommend it? To who
would you recommend
it? If somebody comes with very dry, very crappy skin with a loss of volume, and they are
But the
undergoing...
Profhilo doesn't increase the volume, right?
It doesn't increase the volume, but it increases the collagen, which
Yeah.
then will increase the volume indirectly over a period of months to possibly years.
Yeah.
So I would recommend it in combination. This is the key here, in combination with other treatments. I would not recommend Profhilo on its own. I think if you were to have it on its own, you may well be disappointed with it.
Yeah, one of the things that I looked in the study, and a lot of people come to me for Profhilo because they're scared of fillers.
Yeah.
So, but if fillers are injected properly, then you shouldn't be scared of it. But some people have Profhilo, and then they kind of especially after the first treatment, they're like, I don't see anything.
Yeah, we get
And
that a
sometimes
lot.
I'm like, I don't see anything after, right? I had some before and afters of Profhilo, but they're always combined with, I guess, other treatments.
Yeah, they come in for their second injection as well.
They come in for the second, and maybe after the third, then they start noticing that little bit of thing. And actually, if you're a younger age range, like between the ages of 25 and 45, you notice it a little bit more. Beyond that time period, I just do not treat with Profhilo because I'm like, it's a waste of your money, guys.
Yes. So in my case, as I alluded to earlier, I would treat the older age range, older skin, but I would combine it with other
So
treatments.
you do like Sculptra, all that sort of thing. Look, have a look at the study. So this is the actual study that Profhilo did, I think in sort of 2016, if I'm not correct.
That was the original study.
Looked at the 16-week study, and some of the things that they actually measured were quite interesting, looking at the effects that they had. And they had 64 female subjects, so only females between the ages of 30 and 60, okay? And they did standardize it quite nicely, as much as you can do within a study. And they injected in the same way that a lot of people inject those 5 points, and they did the treatment as well a couple of times, and then they analyzed them after a number of weeks. What they actually noticed was an increase in hydration. So that's definitely, so you said a dry things. And they also put people on a wrinkle severity scale, okay, which is a visual scale looking at it. And it showed a reduction probably in around 20% and up at 8 weeks, 24% at 12 weeks, and 18% at 16 weeks. So, 4 months after the treatment, you've got an 18% reduction, okay? So I guess, 18%, 20% reduction in kind of wrinkle reduction. That's pretty good, actually, isn't it? Looking at that. And then some cheek volume loss. They also saw kind of an improvement in the cheek volume as well. So, we said, like you say, lack of volume, a little bit of wrinkle reduction. But it's not groundbreaking
Indeed.
because if you see something like a less than 20% improvement, it's not groundbreaking,
It is.
but it's an improvement.
My criticism at that study is that it is a limited number of individuals.
Absolutely.
It was only limited to female
Females.
patients, and it was also organised and conducted by the manufacturers themselves.
Wow. Yeah. Biased. Yeah. I
mean, there is a potential bias there.
There's a potential bias, and you look at some of these people, like they answer some self-evaluation, which I don't really think self-evaluation is great. But what they really said was, if you looked at self-evaluation, they looked at evaluation of reduction of deep wrinkles. 14% of people said nothing. 13% said it only very slightly. 55% medium reduction of deep wrinkles. So deep wrinkles, forget about it with Profhilo. It's not going to improve. Reduction of superficial wrinkles, 30% said it worked very well. But that's only 1 in 3 people saying that it worked well. I mean, that's not really that great. And then if you look improvement of skin smoothness, which I think Profhilo is the best thing at, only 48% of people said that they noticed a lot of improvement in that. And the rest were like on the fence. So, you got a 48% satisfaction rating for the highest point.
Which isn't great in aesthetics.
It's not great, because if I put filler over here in the nasolabial fold or the cheek, I would get a greater than kind of 95% satisfaction rating. If you look at, say, for example, Sculptra that we talked about in another video, you've got an 85% satisfaction rating at 2 years. Yeah. So that, for me, when you're charging pretty much just a little bit more per vial of Sculptra than you are Profhilo, that's an investment in the face, and it lasts longer. Beyond 6 months, Profhilo, it just kind of wastes away because your body turns over hyaluronic acid.
So in summary, in my opinion, is it worth the spend on its own? No. In select patients, I would combine Profhilo with other treatments.
Yeah, I think my summary is that if you're dipping your toes and you're in that younger age range and you want something very light, something that no one really kind of wants to know about, that you can't see, just you want to prevent almost, then, and you've got the funds for it, then definitely it is worth it. But if you want to invest in your face and you want a little bit more marked results, then I don't believe that it's worth it. Now, I have access to everything. I mean, I have botulinum toxins, I have Botox, and I do energy-based stuff, and Sculptra, I do. So I think that those things are really kind of, they do what they say on the tin. With Profhilo, sometimes even I look at patients, I'm like, yeah. But I know it's good for them, and I know they're seeing there's 20-30% very subtle gains. So I wouldn't say go as far as it's not worth it, but it's not in my top treatments when I look at someone, and I find that I don't do it that often when patients don't ask for it. When patients ask for Profhilo, sometimes I talk to them about the other stuff, like the other skin boosters that are there, because sometimes they're more appropriate.
Okay. So that is our verdict on Profhilo.
So look, one of the things about this channel is that we're really honest about our practice. We're not really promoting our practice at all. We're super busy and we've been around for more than a decade doing this. We just want to teach you about kind of the lessons that we've learned from our practice and just honest things. So, if you like that, just click like, subscribe. And any more kind of honest videos that you guys want us to create, we'll create.
Just let us know and we'll create those videos for you.